Taiwan's COVID epidemic is continuing to wane, with only 35,699 new local cases reported on Friday. But the death toll remained high at 121 fatalities, including an 18-year-old. Since the start of the year, 5,919 people have died of the disease, making for a mortality rate of 16 per 10,000 people.
In related news, the CECC has announced guidelines on how it will define a COVID reinfection. With more people catching COVID twice, clearer rules are needed for counting reinfection cases. Let's hear from the CECC.
那针对这个重复感染的定义呢，我们有分成，就是说是确诊后的1到3个月之内。
Our definition is different for people reinfected 1 to 3 months after their first infection, and for people reinfected more than 3 months afterward. For people reinfected 1 to 3 months afterward, 2 conditions must be met. First, their symptoms need to get worse as evaluated by a doctor. The second condition pertains to testing. They need to test positive on a PCR test and have a CT value lower than 27. Or they must test positive on an antigen or nucleic acid rapid test. Only when the conditions are met will they be counted as reinfections. If it's past the 3-month mark, the person only needs a positive PCR test and a CT value below 30, or a positive result on an antigen or nucleic acid rapid test. Once a report is made, that person will be counted as a reinfection.
The CECC has updated its national notification system to account for COVID reinfections. Doctors say now file a report of a suspected reinfection in a patient. Doctors may prescribe antiviral medication to reinfected patients if needed. Reinfected patients will also be handled the same way as first-time patients if they require intensive hospital care.